Let me mention a little something here. The FDA has recently put an emphasis on the development of AI technologies. You know, what do you think of the FDA or the government's role in promoting this? Because Scott Gottlieb recently said, I'm going to smooth out the pathway so that AI-type medical devices and medical technologies can find an easier path through the FDA. What do you guys think?
So, you know, from my point of view, you know, regulation is always trying to catch up to innovation, right? So I think there's a fine balance of innovate, 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 and then regulate, 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 right? Telemedicine's a great example. We know it makes sense, we know it works, but the regulation's holding it up, right? With AI, I think the biggest fundamental issue is going to be trust. We've seen all the things about Alexa, right? This is really personal information. I mean, a mental health history, a sexual history, a cancer history. There's employment implications, there's family implications, financial implications. So I agree with you, John, again, that it's about scaling the conversation and taking those algorithms, but fundamentally, I don't want to talk to Alexa about my cancer diagnosis, right? So there's going to have to be, you know, I want to talk to a person.
But it could be supplemental, right?
But it could be supplemental. I think that makes sense.
8,000 oncology publications a day. 8,000 a day. Go ahead, you be my oncology expert. I want the computer. Today, I want the computer to augment my physician's input.
I'm not smarter than Alexa,
right?
But you can
it's
trust
AI,
me.
It's IA, not AI.
Trust me,
okay?
But you can trust me. But same concept,
For
right?
a few years, just a few years.
But you can trust me, right? I'm not pretending to be smarter than Watson, Alexa, machine learning, Avenel, whatever it might be. But there's still that trust. And there's also HIPAA. I mean, there are things that keep you accountable.
But there's a lot to be said in taking 5 minutes when you're making rounds on 50 patients on the cardiovascular ward and sitting on the end of that bed and holding that patient's hand and saying, I understand you're scared. Yes, we're going to have to put in a pacemaker defibrillator.
And you know what? Candlelight is really romantic.
I'm sorry. I'm a doctor and a physician and a healer first, and I use technology to make me better at what I do, but technology will never replace empathy, caring, love, and concern for our patients. I have to...
I think that you're barking up the wrong tree.
John, how many kids do you have?
3.
3. Would you like them to be delivered by Watson? Was that like a big
no, not Watson, but maybe Watson 3.0. Absolutely. Come on, Da Vinci. Robotics, prostate therapy.
I'm just saying,
My
Jane,
wife,
am I
of
right?
course,
Your
is
wife
not
may
going
not
to
agree.
be.
All right, let me put a perfect example.
Right.
Da Vinci was sold to my hospital as a way to put on left ventricular leads in patients who needed a BID.
You don't need that.
Do you know what happened? 90% of the time we dropped the lead, had to open the thoracotomy and do it that way. Da Vinci was designed for that purpose, turned out to be fantastic for prostate.
People die in driverless cars. So should we run from driverless cars?
No, I'm not suggesting that, but I'm saying that if you get into a world where technology is all you have, and you take away the humanness of medicine, you've destroyed the construct
Kevin, why
of
do
the
you
doctor-patient
make humanness as the standard of excellence?
Because that's what doctors do. We care.
Today.
We should always care. Otherwise, there is no art of medicine. If you have sat on a patient's bedside and saw the fear in their eyes, I can use Watson to tell me what chemotherapy drug to give at what rate, but connecting as a human, that's what's so important. That's why I became a doctor.
I have to interject a fact here, which ties this together.
Don't confuse me with facts.
That's my job.
I'm not interested in that.
Please.
You must be an economist.
I am. So I'm all about the data. So this morning in my blog, Health Populi, I wrote about a new study that just came out, global study, 10 countries, from Axiom, the big data company, retail data, and the DMA in the UK, which is now owned by the Association of Newspaper Advertisers. Here's what the study asked. People around the world, who do you trust to hand over your personal information to? Not health information. The question was, who do you trust? The #1 organization type was doctors. And in the US, way more doctors, followed by banks, retail, grocers, and government toward the bottom.
So Facebook wasn't mentioned?
Pharma wasn't pharma? Humana?
No.
Payers?
So doctors above retailers, and you know how much I love retail health and all in my work. But the nexus of trust for data, and we have to remember, AI is hungry for data and the right data. It's not just in the EHR, it's my sex, drugs, rock and roll data. It's talking about wanting to get on the floor with grandchildren or wanting to travel or golf, not just what's in the Allscripts Epic record. So we need patients to trust providing all of this data, the social determinants of health stuff, along with the clinical data, so AI can be as rich as it can be. Because if AI is just about the stuff in the EHR, we're not going to really get to the heart of the patient. And I totally agree that the art of medicine is part of the healing and the outcome.
Jane, let me be clear. I agree with you and Kevin, and I disagree with John, right? It goes back to the first question, which is that patients are going to the doctor for access, for a conversation, for a solution to their problem. And AI has a role, but it's not the role. They're not going there for the technology. It has a role, a very important role, to your point. But I go to the pediatrician with my 6-year-old because we have a question, we have a problem. And if I can text my doctor, if my doctor uses a great, amazing computer in his chart, excellent, but I'm going to the doctor to see the doctor. That's it. And I'm a doctor saying that.
Look, I mean, you know, so patients put doctors on top of their list. You know, you can ask anybody from Steve Jobs, who said, don't ask customers what they want, to the famous quote of Henry Ford, which is probably incorrect. If I asked my customers what they wanted, they'd say, get me a faster horse. So I don't think in the context of innovation and disruption, this meager, human-centric patient perspective is going to drive the change. It's going to let us wallow in mediocrity. So I think you're way off base.